Today's topic is nose and nasal septum. The objectives are to learn about the external nose, the nasal cavity, nasal septum and their features, the blood supply, nerve supply, lymphatic drainage, development and the clinical aspects. The external nose, it is having two functions, that is the respiratory function. It acts as a passage for the air and it also acts as the organ of smell. The receptor for the smell is placed in the upper 1/3 of the nasal cavity and it is having the olfactory mucosa in that region and the remaining part is lined by the respiratory mucosa. The nose is highly vascular, it warms the inspired air. The secretion of the serous glands makes the air moist and the secretion of mucous glands trap the dust and other particles. The olfactory mucosa which lines the upper 1/3 of the nasal cavity and the roof formed by the cribriform plate and the medial lateral walls of up to the level of superior concha, but the remaining, other than this part, the remaining part is lined by the respiratory mucosa. The parts of this includes the nose divided into external nose and the nasal cavity. The external nose again having the bony part and the cartilaginous part. The nasal cavity is having the floor, the roof, the medial wall, it is nothing but the nasal septum and the lateral wall. The external nose is shaped like a pyramid with its root up and base directed downwards. So, it is a pyramidal projection of the face. It consists of osteocartilaginous framework covered by muscle and skin. So, the parts of the external nose, it includes the root at its junction with the forehead, the tip or the apex and the rounded border between the root and the tip along with the adjoining area is known as the dorsum of the nose. And in the lower aspect there is an elevated part called as the ala of the nose, and in the inferior surface there is a aperture which is the pyriform in shape. These are called the anterior nares or the nostrils. So, each nostril is bounded medially by the mobile part of the nasal septum and laterally by the ala of the nose. So, the formation of the external nose, we have seen that it is osteocartilaginous structure, that is it is having bony part and the cartilaginous part. The bony part is by the nasal bone and the frontal process of the maxilla which is projecting upwards, and the cartilages includes the upper and the lower lateral cartilages, the septal cartilages and the alar cartilages. So, the nerve supply of the external nose includes the infratrochlear nerve, the external nasal nerve, the infraorbital nerve. So, now the nasal cavity. It extends from the external nares to the posterior nasal aperture which is formed by the posterior border of the omer. This nasal septum divides this into right and left nasal cavities. So, this nasal cavity is having the roof, floor, the medial wall and the lateral wall. The height is about 5 centimeter. The length of the cavity is 5 to 7 centimeter width is 1.5 centimeter near the floor and 1.2 millimeter near the roof. The roof is 7 centimeter long and 2 millimeter wide. The floor is 5 centimeter long and 1.5 centimeter wide. The common cold or the rhinitis is the commonest infection of the nose. It may be infective or allergic, or sometimes it may be both, and usually it occurs during the change of the season. Sometimes if there is a fracture of cribriform plate of ethmoid, the CSF may drip from the nasal cavity leading to CSF rhinorrhea. And since the paranasal sinuses are present adjacent to the nose, the infection of the nose may spread into these paranasal sinuses leading to sinusitis. And the relation of the nose to the anterior cranial fossa through the cribriform plate and also to the lacrimal apparatus through nasolacrimal duct also infects these regions. The fracture of cribriform plate of ethmoid with the tearing of meninges may tear the olfactory rootlets also. So, the smell you may not able to smell. So, now the nasal septum. It is nothing but the median osseo-cartilaginous partition between the two obs of nasal cavity. It is covered by mucous membrane and forms the medial wall of both the nasal cavities. So, it is formed by both bony and the cartilaginous part. The bony part is by the omer bone, which is forming the posterior inferior aspect, and the perpendicular plate of ethmoid bone, which forms the anterior superior part. So, other bones which is contributing in the formation of the nasal septum are the nasal spine of frontal bone, then rostrum of the sphenoid bone, the nasal crest of palatine bone, the nasal crest of the maxillary bone, and also the nasal crest of the frontal bone. The cartilaginous part is formed by the septal cartilage, the septal process of nasal cartilage, and sometimes the omeronasal cartilage, which lies between the septal cartilage and the omer bone. It is having four borders: the superior border, the inferior border, the anterior border, and the posterior border. Arterial supply is by the nasal septum can be divided into four quadrants, that is anterosuperior, posterosuperior, and anteroinferior and posteroinferior. Anterosuperiorly it is supplied by anterior ethmoidal artery. The posterior-superiorly supplied by posterior ethmoidal artery. Posterior-inferiorly supplied by sphenopalatine artery, and antero-inferiorly supplied by septal branch of superior labial artery, and also the greater palatine artery. The KIESSELBAC'S plexus. So, it is nothing but the anastomosis of the arteries present at the Little's area. Okay, this area is also known as the Little's area, where the bleeding of the nose is more common in this area. The following arteries are anastomosing in this area: the anterior ethmoidal artery, branch of ophthalmic artery, superior labial artery, branch of the facial artery, the sphenopalatine artery, the branch from the first part of maxillary artery, and the greater palatine artery, the part from the first part of the maxillary artery. So, the sphenopalatine artery is known as the artery of the epistaxis. The venous drainage. anteriorly drains into the facial vein and posteriorly to the sphenopalatine vein. The nerve supply, so antero-superiorly it is supplied by anterior ethmoidal nerve, antero-inferiorly by the anterior superior alveolar nerve, and posteriorly by the nasopalatine branch of pterygopalatine ganglion. The sensory nerves is through olfactory nerve, which is present over the cribriform plate of ethmoid and on the roof. The lymphatic drainage, anteriorly it drains into the submandibular lymph nodes and posteriorly drains into the retropharyngeal nodes and deep cervical nodes. Development of the nose starts at 4th week of gestational age and it develops from the frontonasal process which grows between the primitive forebrain and the stomatium. The frontonasal process gets divided into median nasal process and the 2 lateral nasal process. So, the external nose is formed by 5 processes. The frontonasal process forms the bridge of the nose. The 2 fused medial nasal processes forms the dorsum and tip of the nose, and the 2 lateral nasal processes forms the sides and alae of the nose. The nasal cavities develop from the ectodermal nasal pits. So, the nasal pits deepen dorsally during the 6th week of intrauterine life to form nasal sacs. Each nasal sac grows dorsoventrally to developing forebrain to form the primitive nasal cavity. So, dorsal end of the primitive nasal cavity is separated from the oral cavity by oronasal membrane. So, at the end of 6th week this membrane ruptures to form primitive choanae, and that is how they communicate with the primitive oral cavity. So, the external openings of the nasal pits persist as the external nares. So, each sacs grows dorsoventrally to the developing forebrain to form the primitive nasal cavity. Clinical anatomy. So, deviated nasal septum. So, usually the nasal septum is present at the center, dividing it into 2 equal halves. So, in the normal picture we are observing the nasal septum is present centrally. A little deviation may be present, but if it is more obvious, as in the obstruction, the picture in the obstruction we are seeing the deviated septum, there is unequal division of the right and left nasal cavities, and we can observe the enlarged inferior turbinate in the one side, that is opposite to the deviation, and it causes the cold, allergic rhinitis or sinusitis, etc. So, if it is causing the obstruction frequently, so it may require the surgical correction. Then fractures of the nasal septum may occur anywhere, and the more common site is at the junction of the septal and the bony part. The epistaxis, we have earlier seen, that is the common area for the bleeding of nose is the little's area. The sphenopalatine artery is the artery of epistaxis. So, if it occurs in the little's area, the bleeding occurs from the nostril, and in the anterior nares we can see the bleeding. Sometimes the bleeding occurs in the posterior because of the posterior ethmoidal arteries, then the bleeding can be go down to the throat. The nasal polyp, it is a benign enlargement occur over the mucus, and it occurs because of a frequent infection or the rhinitis. Sometimes if the size is enlarged, it may cause the obstruction, and sometimes usually it can be treated medically by spraying the steroid. If it is not gone through the medication, then the surgical removal is necessary. The questions for assignment: the nasal septum, formation, blood supply and nerve supply, the components of the nasal septum, and the development of external nose and nasal cavity. So that completes the external nose and the nasal septum. The lateral wall we will discuss in the next session. Thank you.